Welcome to Part 4 of the Nutrition and Weight Loss class. This section covers carbohydrates. So when I say carbohydrates, what foods come to mind? Grains, that includes bread, rice, pasta, tortillas, cereals. Fruits, vegetables, legumes, beans and lentils, some dairy products, specifically milk and yogurt, and anything with added sugars. Carbohydrates, also known as carbs, are the primary energy source for the body. The different types of carbohydrates include sugars, starches, and fiber. For every gram of carbohydrates, you get 4 calories. It's important that we're choosing complex carbohydrates versus simple carbohydrates. We generally recommend that you avoid simple carbohydrates after surgery, and we'll talk about the difference between these two here in a moment. Your goal after surgery is 60 to 80 grams of carbohydrates per day for the first year after surgery. Think back. What was that protein goal again? Yep, 60 to 80 grams. We're trying to make things easy to remember, so think 60 to 80 grams of protein and carbohydrates. Those are your goals. After the first year, your limit for carbohydrates can gradually increase to about 100 to 130 grams per day, but this can be dependent on person. What their ultimate goals are with weight loss, if they have continued weight they need to lose, and how active they are. Someone who's incorporating a lot more activity into their day and exercise will generally need more carbohydrates than someone who might have more of a sedentary desk job. Here are some great examples of carbohydrate content in foods. And you can see how some foods add up in carbohydrates much quicker than others. For instance, a half a cup of granola has 35 grams of carbs, and one large flour tortilla has 44 grams. If your goal is only 60 to 80, you've consumed a lot of your carbohydrate intake for the day with one of those items. Whereas a medium apple only has 20 grams of carbohydrates, and a medium sweet potato about 26 grams. So let's discuss the difference between simple and complex carbohydrates. Simple carbohydrates are made of 1 or 2 sugar molecules and are easily absorbed into the bloodstream. That easy absorption rapidly increases your blood sugar levels. And rapid increases in blood sugar are not a good thing. They also lack vitamins, minerals, and fiber. Sources include white bread, candy, desserts, and anything with added sugar. Complex carbohydrates, on the other hand, are made up of 3 or more sugar molecules, so they absorb more slowly in the bloodstream because it takes more energy to break these apart. They lead to steady blood sugar levels, which is what we want to see throughout the day. They contain vitamins, minerals, and fiber, and our sources include whole grain breads, starchy vegetables, beans, and fruit. So we want to choose more complex carbohydrates and avoid and eliminate those simple carbohydrates. Simple carbohydrates, as I stated, also include those added sugars. I want to look at this in a little bit more detail because added sugars are the #1 reason for dumping syndrome after surgery. Dumping syndrome is a side effect where the contents of the stomach rapidly move into the small bowel, causing water to come out of the blood vessels into the body and into the small bowel. It can cause nausea, vomiting, cramping, bloatingness, diarrhea, lightheadedness, kind of have the shakes and jitters. Not very pleasant side effect, but it can be avoided. and that's why we recommend avoiding those simple carbohydrates. Sodas and fruit drinks actually contribute the highest amount of sugar in the American diet. Caloric beverages after surgery have also been shown to promote weight regain. This is why we encourage you to drink water to satisfy your thirst. Also, avoid cold cereals, which tend to have a high sugar content. Most cereals actually contain greater than 60% sugar. After surgery, we recommend limiting your sugar to no more than 15 grams per meal. There are multiple different names for added sugar, as you can see listed here. Honey, maple syrup, agave, while they are natural, they are still absorbed in our bloodstream just like an added sugar. So we do need to be cautious when using these products. Non-nutritive sweeteners like stevia, Splenda, or Sweet and Low will be fine after surgery. They tend to not cause issues like dumping syndrome. Grains provide a large source of carbohydrates. They're a good source of B vitamins, iron, and fiber. But post-surgery, many grains should be avoided for the first year. This includes bread, rice, pasta, and tortillas. The reason we recommend avoiding these the first year after surgery is because these are foods that can easily swell. If you're eating foods that easily swell and take up space in the stomach, you're generally not going to be getting in your protein goal. Also, they can easily get hung up going down, which is not very pleasant. And most patients who start to introduce these things sooner than the first year can slow down their weight loss and ultimately not meet their goals. When we are choosing grains, though, we want to choose unrefined versus refined. So let's look at what the difference is. So on this slide, you can see a wheat molecule. The inner part contains the endosperm, which is the starchy part of the grain. The bran is on the outside, which contains the fiber. And the germ contains the vitamins and minerals. When we process grains, a lot of times we process them where we remove that bran and germ. So we're removing the good parts, the fiber and vitamins and minerals. So that leaves us with just the starchy endosperm to make white, fluffy bread, flour, cereals, and rice. Unrefined complex grains, when they process these, they leave the bran and germ intact. So it's leaving all the good stuff still on the grain. Sources include whole wheat bread, whole wheat flours, whole wheat cereals, brown rice, oatmeal, and quinoa. Fruits and vegetables also fall under the carbohydrates. They help our eyes, hair, blood, and it boosts your immune system. They're good sources of vitamins, mineral, and fiber. And fruits and starchy vegetables are healthy sources of carbohydrates. Our goal is to have a serving of vegetables and fruits with every meal and snack. When we're looking at vegetables, there are non-starchy vegetables and starchy vegetables. Non-starchy vegetables typically are the flowering parts of the plant. They contain very little carbohydrates and allow you to stay full for less calories. Examples include lettuce, asparagus, broccoli, cucumber, mushrooms, peppers, and tomatoes. The non-starchy vegetables are the highest volume foods you can eat for the fewest amount of calories. Starchy vegetables include several types of roots, bulbs, and kernels. These are still complex carbs, are good carbohydrates, but Because they contain a little bit more carbohydrates, they do contain more calories than non-starchy vegetables. Examples include corn, peas, potatoes, squash, pumpkin, parsnips, and beans. It's not that starchy vegetables are bad for us, but we do need to watch the amounts in which we consume them in. Also, be careful for the additional add-ins that we generally add to these. Take a typical white potato, for instance. We normally don't eat it plain. We fry them to make French fries. We add butter, sour cream, bacon, and cheese. That's what adds up in calories. It's not necessarily the white potato that's adding up. A sweet potato, on the other hand, when baked in the oven, is really nice and sweet, and we don't have to add as many add-ins to it. The recommendation for fruits and vegetables is to get in 5 or more servings per day. A serving of vegetable is a cup of vegetables, a half a cup of beans, 2 cups of lettuce or leafy greens, a medium piece of fruit, 1 cup of unsweetened canned fruit, or a cup of sliced fruit or berries. Immediately post-surgery, you probably won't be able to get in the full 5 servings per day. But as you are able to tolerate more volume, we encourage you to incorporate in more vegetables and fruits versus adding in additional servings of protein and carbohydrates. And our goal with fruits and vegetables truly is to eat the rainbow. Each color represents different vitamins and minerals. So when you're at the grocery store, look down in your cart and make sure that when you're leaving the produce section that you're seeing variety when it comes to colors. Fiber is also a component of carbohydrates, and the Dietary Guidelines for Americans recommends we get in 25 to 35 grams of fiber per day. The average American only consumes less than 10 grams per day. And it makes sense because fiber-containing foods include vegetables, fruits, beans, and whole grains, things that are generally lacking in the average American diet. But we want to get more fiber in because there's multiple benefits. It helps with weight management. It lowers cholesterol. Fiber actually naturally pulls cholesterol out of the body. Helps with bowel motility, making your bowel movements more regular. It helps with satiety, which means fullness. Keeps you full for a longer period of time, which is why it can help with weight management. And it decreases your risk of colon cancer. On this slide, you can see the fiber content in some common foods and how quickly they add up. When you're incorporating in more fruits, vegetables, beans, and whole grains in your daily diet, you can see how you can easily meet the 25 to 35 grams recommended per day. Now that we've talked about both protein and carbohydrates, you might have noticed there were some food groups that actually fell in both categories. So dairy helps maintain strong bones and teeth. It's a good source of calcium and protein, and milk and yogurt are healthy sources of carbohydrates. Your goal is to have 3 servings of a low-fat dairy food per day. But it's important to recognize what a serving size of dairy is. 8 ounces of milk, 1 ounce of cheese, like a string cheese, 6 ounces of yogurt, or 4 ounces of cottage cheese. Legumes include beans, peas, and lentils. They're good sources of protein, fiber, and vitamins and minerals, and they contain healthy carbohydrates. Try swapping a meal with meat for a meal made with legumes to save fat and calories. Dairy and legumes are a great way for you to get in protein after surgery. Many times after surgery, a lot of lean meats aren't always well tolerated. Especially think of like a dry, overcooked chicken breast. Isn't going to go down very well. So if you're not tolerating meat products very well, this is where we want to encourage more dairy and bean consumption to really make sure you're getting your protein in. Next is part 5, fats and reading a food label.